The second time around, the discharge planning was much more appropriate. I was referred to the community team for ongoing follow-up. I was assigned a case manager and a psychiatrist to regularly consult and check in on with me in the community. And that plan was much more thorough. There was better communication. It was longer in the planning, and it meant that all parties knew what the plan was and what we were going to do going forward. And the community team who looked after me post-discharge were amazing, and it was a really positive experience having them almost to catch me at the other end, and provide that continuity of care while I was in the community. And that was very different to what happened the first time around.
I think all consumers in the perinatal period should have a comprehensive post-discharge support plan that involves supports for their mental health, their partner or carer, and their infant going forward. And ideally, referrals to community support should be made while that consumer is in the inpatient setting, just to smooth that transition and facilitate as an easy a discharge as possible. So we really heard from Amanda's story the difference between a planned discharge and one where things happen in quite an ad hoc way in terms of the outcomes for her family. I think that if we can support consumers in the perinatal period to have trial leave at home, that can really help that graduated approach to assist families to allow that parent to retake some of their parenting role that may have been, less during that separation period, and also for the consumer to build confidence around being back in that role as a parent. Or a hands-on parent, because obviously they're always a parent. So periods of trial leave and comprehensive kind of community supports being brought into place are both very important.
As mum starts to recover, we then invite some of the other teams that will be seeing them in the community to come in, have conversations, also pace that. What can mum what is the mother able to take in relation to information? What causes her to be overwhelmed? Explore that a little bit more, because sometimes these are the very subtle things that can get missed, and they need to be acknowledged and time spent to actually clarify them.
The community care can actually begin while the mother is in hospital by introducing community caregivers. They will seem a lot less scary, if you like, outside, and the mother will have a much better understanding of what will follow the inpatient phase of her care.
Women will usually need ongoing support, psychoeducation, and encouragement to remain on the medications they have started on whilst in hospital. A range of psychological interventions may also be useful at this point. This may include one-to-one psychological therapy, relationship or family counselling. Some women may also find group programs like postnatal depression groups and circle of security parenting groups to be useful. Often at this point, the focus is also on returning the woman back to her connections within her family and community, and supporting the bonding and attachment between her and her infant and the other children. This process might include making some sense of the episode of illness and the time in hospital, the diagnosis and ongoing treatment, as well as regaining lost parenting confidence. Partners and family would often also appreciate some advice on how to encourage this woman to regain her role within the family and community whilst supporting her recovery from illness.